Still at the Green Chamber, the House of Representatives has warned that reduced funding for the agricultural sector could undermine Nigeria's food security ambitions and weaken economic recovery efforts. These and other concerns over poor investment in medical research dominated deliberations at a budget defense meeting between lawmakers and some government-owned hospitals. National Assembly correspondent Joke Adisa reports.
Rollover is now a constraint for us.
At this session, the Federal Ministry of Agriculture and Food Security outlined ongoing efforts to strengthen domestic food production and reverse food insecurity. The Minister of State for Agriculture and Food Security said government interventions are focused on expanding production, improving sustainability, and stabilizing the nation's food system.
If you ask me if we are satisfied with what we have, because it's a rollover, otherwise we have some very good projects we have started, which we will have loved to have funding for.
Lawmakers say agriculture remains central to national stability, serving as the primary driver of food security, employment generation, poverty reduction, and sustainable development.
If this trend continues and funding in this year remains insufficient or is released untimely, it will significantly undermine agricultural performance, deepen Nigerians' food and nutrition insecurity.
Elsewhere, the House Committee on Health Institutions faulted some tertiary health institutions for allocating less than 1% of their budgets to research. It insists lack of sustained research left the health sector unprepared during the COVID-19 pandemic.
We are not researching. I have gone on oversight with some of my colleagues. There is no hospital today that can tell me that they took me to a place and said, this is where we conduct our research.
China and Israel have come up with very new technology of identifying cancer at least before it even happens.
The Chief Medical Director of the Jos University Teaching Hospital responded on behalf of the Committee of Chief Medical Directors. He says inadequate funding remains a major constraint.
We are able to do much as you desire as a committee of House of Representatives to move the tertiary hospitals in Nigeria, to give Nigerians befitting hospitals where they can go and get their health addressed.
Manpower shortages driven by the Japa syndrome, high electricity costs under Band A tariffs, and the need for take-off grants for newly established health institutions are just some of the challenges of hospitals. Joke Adisa, TVC News, Abuja.